Good morning to everyone. Good afternoon for the people who are in the East Coast or Central Time. I'm very glad for the opportunity to talk today about integrative approaches to breast cancer. Today's presentation will be, part of it will be a general presentation, and then a lot of it will be dedicated to questions and answers. Just 1 second, I just have to solve an issue of how do I get rid of this thing? And then the screen doesn't move.
Do it again.
That's my apologies. We just have to. It seemed to have worked a moment ago. Just 1 second. We're going to try to fix it. So today, the topic that we'll cover in this webinar, we'll talk a little bit about the epidemiology, the risk factors of breast cancer. A lot of them are known, but look at a little bit greater in-depth understanding of why they happen and how we can manipulate and change them. We want to talk about important things that we need to know as part of an integrative care for breast cancer. We'll talk about integrative treatment approaches. We'll talk about galectin-3 and breast cancer, a specific area where I have a lot of research. And we'll talk how to support treatments in the preparatory phase, during the treatment, and after the treatment. And some research studies on some unique nutritional supplements that I've been involved in researching for many years. And then, of course, we'll have the question and answers, which is really the most exciting part of the webinar. So really, breast cancer is an epidemic. And just if we look at the facts and figures, it's the most commonly diagnosed cancer among women. About 260,000 new invasive cases every year in the US. And second leading cause of cancer death among US women. Lung cancer is still #1, but there are many more cases of breast cancer. It's just that many of them are diagnosed at an early stage with very good prognosis. A high percentage of women survive breast cancer. It's important to know, it's important to recognize. The lifetime risk of dying of breast cancer is about 3 to 4%. And survival at 5 years of the whole group is 91%. At 10 years, between 80 and 86%, different statistics. At 15%, around 80%. But of course, percentages are very important, but they are percentages. For the people, each of us, each person who has breast cancer, each person who has a serious disease, it's what I like to call N = 1. We are the whole universe. So statistics are important in making decisions, but decisions have to be made individualized. If within a certain statistics there is a way for us to make a decision that is more targeted towards what we need, then statistics really become secondary. And that's a fundamental difference between true integrative medicine, which looks at the person as a whole universe. That's what holistic is about, compared to medicine that is driven by statistics and just large clinical trials, where the individual doesn't play a part. What I call, when you go and get an opinion from one oncologist and from a second oncologist with this approach, and not everybody has this approach, of course, it's really not getting a second opinion, it's getting a second first opinion. So we really want to see what is about the individual, about you, about me, about each of us that makes us unique. Then we can target the therapy specifically to our needs. So there are more than 3.5 million women with history of breast cancer right now alive in the United States, and men also get breast cancer. It's much less common, and about 460, 480 men who die every year from breast cancer. but men tend to be diagnosed at a later stage, and that's why the outcome is not as good. So what are the risk factors? And many of them can be modified by the choices we make. So there are some of the classical ones: genetic predisposition. So, there are a lot of genetics testing, the BRCA genes, other genes. But actually, genetic predisposition is much more detailed than just these very commonly tested genes. It's, for example, how well do you process toxins in your liver? Where is your detoxifying system working? Some people, the liver doesn't work well, but the skin works very well, or the urinary system works well, or the gut works well. So we want to look at these different genetic predispositions and combine them with lifestyle and illnesses we had and exposures we had during life to get a better understanding of the predisposition. High breast density increases the risk, height, the taller we are, hormone balance and hormone metabolism, which I will touch later, and age. From reproductive factors, classically, the longer you are exposed to menses, the greater the risk. So early menses, late menopause, late pregnancy or not having children, all of this, lack of breastfeeding, all of this increases the risk. So breastfeeding is a very big one. And that's why I'm a great proponent of breastfeeding, not only because of this, for multiple reasons. It affects the health of the child dramatically, lymphomas, leukemias, for example, in children, but also helps the mother in a significant way. Fertility drugs, hormonal birth control, and postmenopausal hormonal therapy, HRT, which is still HRT even if it's a bioidentical hormone. It's still hormones, it's important to remember. So from a diet and lifestyle, overweight is a huge thing. There is direct correlation between overweight and not only risk of cancer, but how aggressive cancer is. It's quite an incredible story when Herceptin, which is one of the better discovered new drugs for breast cancer, not very new, was presented first time at ASCO. It was shown to decrease the 1 year recurrence by almost 50%, which was very dramatic. And I heard the story from somebody who was in the audience. The room was packed with journalists. But in the same session, there was a study showing that women who lost 4 to 5 kilograms, 8 to 10 pounds after treatment, doubled their 5 years survival, much more dramatic than Herceptin. Not one journalist wrote about the dietary study. The whole focus was on a drug. But overweight is very important. And it ties into the diabetes and insulin resistance, which we really don't have a lot of time to touch in such a short cycle. But basically, when people are overweight, there is more tendency for metabolic syndrome, for insulin resistance. The body excretes more insulin that degrades the immune system and also affects the metabolism, which makes cancer more aggressive. Lack of physical activity that relates to this. When we have physical activity, our mitochondria functions normally, which again helps us to prevent cancer and heal better from cancer and respond better to cancer treatment. And alcohol consumption and smoking, which are definitely significant risk factors. Alcohol at any amounts. And environmental and other factors, radiation exposure, DES exposure, pollutants, environmental estrogens, and night shift work. So if we look at the family history and personal characteristics section, you will see hormone balance and hormone metabolism. If we look at hormone metabolism, we can see how complex it is. The whole issue of reproductive factors affects the exposure to hormones, right? How long were your menses? Did you breastfeed, which balances oxytocin and different hormones, and prolactin and other hormones? How is your diet and lifestyle? If you are overweight, insulin resistance, it affects your metabolism. It affects how you will metabolize hormones. It will degrade your immune system. But I like to use the term hormonal modulation. It's not hormonal replacement, but it's modulating the processing and metabolism of hormones. So we can know a lot of it based on lifestyle and the person's structure, But we can also do different tests, where we test estrogen metabolites in the urine to see which pathway is the body picking. And this is very important when we choose our therapy. And this is something that is not conventionally done, but it will affect your decision of what drug to use, what hormonal therapy to use, how long to use it, how to balance it, how to enhance it. So the estrogen pressure on a tumor can be affected by environmental estrogens, xenoestrogens, by pollutants that cause both, and heavy metals that cause DNA damage and cause metabolic shifts that are abnormal. It will increase oxidative stress, damage to the cell, will reduce our ability to repair our cells. Radiation exposure, of course, will add to it. And radiation of all kinds, cell phone radiation, radiation from all the internet devices, right? Cosmic radiation, radiation from pollutants, and radiations from so much inflammation that we have all the time around us. And night shift work that affects our levels and balance of melatonin. Melatonin is a big protector for breast cancer. When we work during the night, we disrupt our melatonin cycle. So when we really build a program for care, we really take all of this and we really focus on the individual unique life story. And this is really important to do. We are in an era where natural medicine is becoming popular. There are more and more people who are doing it, who are well trained. But in the same time, it becomes more and more about regular thinking and using natural methods. And this is really doesn't address this idea of understanding the individual unique life story. There are certain medicines that specifically offer an understanding of the unique individual life story, very specifically Chinese medicine and some other multifaceted, multidimensional medicine. So within this understanding of the individual unique life story, we want to look at the person's physical, emotional, and spiritual health, how they interact with each other, what we often call body, speech, and mind. How the mind is interacting with the body, because it can affect hormonal metabolism, immune function, circulation, etc. We want to look at family and community support, what kind of support a person has. And we want to look at the personal goals of the person. If the person is very driven into living a long life, if they have long-term plans, the body has a reason to heal. And we want to look at other illnesses, at comorbidities. What other illnesses can affect our current health? For example, if someone has systemic lupus, an autoimmune disease, they have tendency for hyperviscosity, tendency for inflammation that can make cancer grow faster. Just an example. So we want to understand all of this, and all of this allows us to really understand the person better. The more the person has support, the more the person has focus, the more the person is more balanced, then potentially they can rely less on aggressive outside treatment and rely more on their own inner capacity to heal. The less support that people have within this area that I discussed, the more we need help from the outside. Important to recognize in an insightful and in an objective as possible way. We want to understand the terrain. We want to understand what is the environment in which the cancer is growing. Is the tissue acidotic or is it alkaline? Is it well oxidized? Is the mitochondria functioning normally? Is there insulin resistant, a lot of insulin glucose receptors that are causing expression of genes within the cell that are not favorable for healthy cell and are favorable for aggressive cancers. And there are specific ones, of course. And what is the unique, and within all of it, when we have the person, we can then look at the tumor and the unique tumor biology. And that's where genomic testing are very helpful, and other clues as to how the tumor is developing. This is where getting lab tests as a baseline before we start treatment. We get a snapshot of our basis before treatments. Once we start treating, we never get the original picture anymore. That's why I personally emphasize very elaborate investigation of our labs, hormonal, metabolic, immune, circulation, whatever we can get. Then we can build a big story. So now there's a movement to individualized oncology, but it's really based on individualized tumor biology. You can see in this picture that tumor biology is only one out of the 6 hexagrams, only one of them. There are so many other details about who we are, about our environment, that are harder to grasp. They become more of an art, less of a linear thinking that if you have this, you do that. But that's really what creates a holistic approach. So within this approach, we now can address integrative therapies within breast cancer. Today, that's the topic. So how can we enhance the effectiveness and reduce the side effects of conventional treatment? So the preparatory phase is extremely important. Extremely important. When we look at the preparatory phase, often we are moved to do something very quickly, and usually it's justified because the cancer is growing. But sometimes it makes sense to wait a little bit longer and really optimize our body so we can really respond better to treatment. For example, if we have an inflamed acidotic tissue that is not well oxidized, that has a lot of free radicals, it will not respond to radiation as well as tissue that gets more oxygen, that has less oxidative stress, that has less of inflammation. Oxidative stress sometimes can help. So when we are preparing, if you have surgery, again, if you make sure that you're nutritionally more balanced, that again, the tissue repair systems are better, that the immune system is better, but especially that we reduce oxidative stress and inflammation, you will heal faster from surgery, and as important, there is less chance of spread of cancer during the procedure. So a lot of this happens in the preparatory phase. It's a very important phase. So for anyone who ever had cancer, was diagnosed with cancer, it's an experience you'll never forget. And somebody who didn't have cancer really can't really understand it, I teach a lot meditation and healing, and I work a lot with cancer patients. And one cancer patient once told me, Isaac, you are the best doctor that really understands cancer who didn't have cancer themselves. So it's different when you have the experience. So in this moment when you are diagnosed, your world gets shattered away. Things that were important fall away. It also creates a space, an opportunity for a shift, for a change. But then usually we are filled up with assignment and tasks and prognosis and fears, and we get overwhelmed very quickly. This time between diagnosis and starting treatment, that's a preparation time. If we can take a deep breath and create more space, breathe deeper, we'll have less inflammation, we'll have less oxidative stress. If we can nourish ourselves, we can prepare ourselves, our immune system will work better, our organ support will work better. So this is done on a physical level with specific diets. It's done with specific supplements, both that have a nourishing effect that supports the immune system, that helps circulation, that reduce inflammation, that will reduce the tendency of the cancer to grow and to spread, especially if you're about to get surgery. And then we move to the support phase. And the support phase is focused on reducing side effects and enhancing treatments and maintaining vitality. The body needs the energy to maintain the treatment and to help support the treatment and make them more effective. So, for example, if we look at chemotherapy, we often take supplements or we do certain things during chemotherapy. But if chemotherapy is, let's say, a 3-week cycle, within the 3-week cycle, our body is very different and our treatment is very different. Let's say that our drug has a half-life of 1 day. It means that after 1 day, half of the drug is gone. After 2 days, 75% of the drug is gone. After 3 days, 87.5% of the drug. Every time HEF goes down, after 4 days, we really have only 6% left. After 5 days, there's no drugs. So in the beginning, you want to make sure that the drug gets into the target tissue. You have to support circulation. You have to expose the tumor to the medicine. That's, for example, why we have to, as we'll talk soon, we'll have to break down the galectin-3 lattices, what we can call biofilm, by using modified cytospectin. So we're exposing the tumor. Once the drug attacks the tumor and it breaks a lot of the tumor, we need to get rid of the byproducts. We need to have detoxification. We have to support the liver, the detoxification systems, the elimination systems. And then at the second half of the 21-day, we now have to build our blood, we have to strengthen our immune system, we have to nourish ourselves so we are ready for the next cycle. So that's an example just with chemotherapy. So you can imagine that a certain supplement will stay all along, modified cytospectin being an example, but otherwise it will change, and doses will change based on the cycle. So the support is very dynamic. We are all dynamic, we all change all the time. And then once we are done with our treatment, then we have to support the recovery. So one of the first things that we do is we have to clean up the mess. We have to clean up the byproducts. We have to clean up the toxins. We engage in detoxification process. But we do the detoxification while we support the vitality of the body so it can get rid of things. So it has the energy to change things. And then as we finish the detoxification, we start shifting towards rebuilding and prevention of recurrence, which is an exciting area that I'm doing a lot of research. That's a little bit about the overview, so you get a sense of the dynamism, and of course there are different compounds that address different issues here. And this addresses the different conventional treatments: chemotherapy, radiation, surgery, immune therapies, hormonal modulation. And we gave examples today just during this quick discussion. We touched on chemo, we touched on radiation, we touched on surgery. We touched on the hormonal treatment before, and for immune therapies, again, can we support the body's innate immunity, and can we make sure that the immunotherapies reach their target? Very similar to what we try to do with chemotherapy. So I want specifically to talk about galectin-3 and how it promotes breast cancer growth and metastasis, and about modified cytospectin that blocks damaging galectin-3 activity, and it's a proven natural blocker of galectin-3. So what is galectin-3? Galectin-3 is a protein that binds sugars, binds carbohydrates. It has an intracellular effect, and cell-to-cell interaction, and an environmental regulation. It stimulates proliferation, growth of cells, inhibits apoptosis, the tendency of the cell to die, creating immortal cells, cancer. It stimulates cell-to-cell aggregation and migration that can create new tumor, and it promotes invasion and metastasis. So it drives both the primary tumor and it drives the metastatic process. It stimulates angiogenesis, new blood vessels, and it inhibits immune surveillance. It allows the cancer to hide from the immune system, and it shuts down the immune system by creating a film, a lattice formation around it. And galectin-3 is what we call an upstream molecule. It's up in the beginning of the chain. So when it's too high or it's too active, it has a lot of other downstream, downward compounds that cause damage. The summary of all of this is that it increases cancer cell survival. One of the other features of galectin-3 is that it promotes inflammation and fibrosis, and that's why it causes degenerative diseases, speeds up aging, and causes us to deteriorate from so many diseases: congestive heart failure, pulmonary fibrosis, hepatitis, kidney disease. It makes all of it much worse, much quicker. So what is modified cytospectin, which is a galectin-3 blocker that I've been involved with for almost 25 years? A lot of the discoveries on modified citrospectin, how to use it are my discoveries. So it's derived from the piece of the citrus fruit. It's a complex soluble polysaccharide fiber, and the normal citrospectins, as you can see, are 60 to 130 kilodaltons, and it's esterified. If you look at the molecule, and I can't point into the screen, if you look at the chain of the sugars in the pectin, which are called galacturonic acid, most of them are green, most of them are esterified. You can see the CHHH on the green one. We have to remove the esterification, we have to cut down the molecular weight, and we have to preserve the neutral sugars like rhamnose and arabinose, which are immune enhancers and help with detoxification. So when it's modified very specifically by the GI tract, it gets absorbed, and we now have proved that our specific modified citrospectin, pectasol C, gets absorbed into the bloodstream. We actually have an antibody, and we've shown that in human testing that it gets absorbed into the blood. And so it can be absorbed, and this is where it has its very important biological and systemic benefits by blocking galectin-3. So for example, if we look specific at breast cancer, that's a very important paper headed by the group headed by Dr. Raz, published in the Journal of National Cancer Institute in 2002, an animal study that showed that when you gave the animals modified citrospectin, you reduce the tumor growth by 70%, and you also cut down on the new blood vessels. So it was a very pivotal study that showed the relationship between reduction in tumor size and reduction in blood vessels, and dramatic reduction in lung metastases compared to control. Very important study. So in this study, as I mentioned, tumor growth, angiogenesis, spontaneous metastases were statistically significantly reduced in the mice that were fed MCP. So MCP research in cancer is very extensive. There are about 40 papers just on our MCP, and which is really the one MCP which is commercially available and is being studied in multiple clinical trials. It shows that in cancer it blocks inhibition of GAL3 activity. It has a synergistic effect with chemotherapy, radiation, botanicals, immunotherapy. It protects against post-radiation fibrosis and damage. It has immune support and an improved quality of life at all stages. It has potential benefit in conjunction with immunotherapies. What does it do? It reduces tumor proliferation, which means the growth of tumor, reduces angiogenesis, growth of blood vessels, reduces the metastatic process, eliminates heavy metals and toxins, reduces inflammation and fibrosis, which are so critical for the pathogenesis of every chronic disease and the spread of cancer. So I also want to touch on a very unique botanical breast formula that actually doesn't have so many ingredients, but the ingredients are uniquely staged, which I formulated quite a few years ago. And we have shown very promising results in multiple animal studies, in anecdotal patients, both in estrogen-positive breast cancer and in triple negative. So if you look just at this formula to look at how you address a holistic treatment within a formula, you have quercetin, you have Scutellata barbata, Baichwashichitsau, you have turmeric, astragalus, DIM, and then you have 3 medicinal mushrooms that are unique in this formula in that they are grown on anti-cancer and immune-enhancing herbs. So we feed the mushroom with herbs that have these properties. So you can see how the quercetin and the turmeric, for example, will address the issue of inflammation. Will also, especially quercetin, reduce resistance to chemotherapy, such as adriamycin. You have the Scutellaria that has a direct anti-cancer effect. You have the astragalus that has an immune-enhancing effect. And you have the DIM that has an hormonal modulatory effect that is beneficial for both estrogen-positive and triple-negative. And for the mushrooms, Coriolus has a direct attacking effect. Reishi has an attacking effect on the cancer, but also has an adaptogenic effect a supportive effect, an anti-inflammatory effect. And felinostat also is a very specific anti-breast cancer medicinal mushroom, not used as often. So if we look at this formula, for example, and this is actually an important study because it's an orthotopic study published at British Medical, at BMC, Complementary Alternative Medicine, which is an important journal. We can see here we actually injected the estrogen positive tumor to the mammary pad of the animals. You can see the higher line is a tumor growing in the control, and then you can see that the breast formula, the BD, and the tamoxifen had very similar effects, but there was a clear synergistic effect between both of them. And you can see on the right that the breast formula had a synergistic effect with aromatase inhibitor and other hormones. Again, we put it in the cell line in low dose, so we don't get an extreme effect. And you can see when we put 40 micromoles of anastrozole, you see a certain decrease. You see a certain decrease a little bit better when you put the breast formula, but look at the significant combined effect. So that's the same concept that we showed in the beginning. It's about how to integrate different approaches to get better response. What's interesting, if we go back and we look at this formula, a lot of the compounds here prevent the side effects of aromatase inhibitors and tamoxifen. Turmeric and quercetin will decrease joint pain and inflammation. Astragalus will support the immune system. DIM will balance the hormones. The mushroom will create damage that can happen from the drugs. So you can see that not only these formulas have a life of their own, but they can use synergistically with acceptable treatments in breast cancer. So specifically when we discuss the modified citrus pectin and the breast health formula, we're looking at a mechanism. Again, this is a diagram from Journal of Integrative Cancer Therapies that is adopted for this presentation. So we can see we're looking at migration of cells, which is an expression of metastatic tendency. We can see that we needed to use one milligram per milliliter of modified citrus pectin to get to about 60% inhibition, and we can get to this inhibition, even a better inhibition, using only 1/4 of the dose of modified citrus pectin, where we are using the breast formula in the same time. That's a great example of synergistic effect. So I want to just summarize the benefits of blocking of galectin-3 in integrative cancer treatments. It reduces inflammation and growth factors, will improve drug delivery to the tumor, will reduce fibrosis and inflammation, will reduce the risk of metastasis. For immune and targeted therapies, it will increase effectiveness, reduce side effects, and reduce multi-drug resistance. And pre- and post-surgery chemo and radiation will help in detoxification, repair of organ tissue, increase immune function, and will decrease the risk of recurrence. So how to use these two compounds, modified citrus pectin, and important to really use the modified citrus pectin that is being used for research. It's often a borrowed, what we call borrowed science. People can use term and it's not necessarily the right product. We only use 1 scoop, 6 caps, 3 times a day when we have an active issue. And for maintenance, that's what we're using in our cancer clinical trials. And for maintenance, only 1 scoop a day, or according to what your health provider is saying. And for the breast formula, I use up to 4 caps twice a day with food. And for maintenance, 2 caps twice a day. And there is a synergistic effect between both of them. So we want to now touch on the question and answers. And we already gotten quite a few questions that I probably won't be able to cover all of them. And the one that I don't, will try to send you an answer. And if I'm done with this, there are more questions coming in right now, and we'll try to add them. So the first question is, can surgery or biopsy trigger metastasis? If so, how can you prevent it? So the answer is very simple, yes. Biopsy or surgery can trigger metastasis. This is a question that is close to my heart because I've been making this argument for almost 30 years. And why did I make the argument? Because it makes sense. If you do a biopsy and you damage, injure the tissue that has cancer, first there can be a spread by the virtue of the biopsy itself, even if very small. So they will tell you statistically it's very small. But if you happen to be the one small rare time that it happens, you don't care about statistics. And during biopsy, during surgery, the body, the tissue, it's trying to repair itself. And when it repairs itself, it excretes growth factors. And these growth factors, VEGF, TGF beta, epidermal growth factors, these growth factors naturally will also make cancer grow faster, will stimulate the growth of cancer. So we really have to address it. Now, just lately, a week or two ago, finally a big study came showing that the surgery procedures in breast cancer can increase the recurrence. And they found that using anti-inflammatories is very helpful, even things as simple as Advil. So addressing the inflammation, the same repair mechanism that the body is trying to use to repair an injury, will help. And of course, one of the leading compounds that will help with this is modified cytospectin, because galectin-3 is what we call an alarmin. It starts the inflammatory process and keeps it going for too long. The different growth factors attached to the galectin-3. I didn't show you the diagrams here because of lack of time. And that's how the galectin-3 surrounds the cancer, binds to the cancer, delivers the growth factors and the inflammatory factors, and you got stimulation of the environment. So for example, I'm going a little bit back, a few slides. If you look at the breast formula, almost, I would say most of the compounds here have an anti-inflammatory effect. Quercetin, scutellaria, turmeric, astragalus, all the mushrooms, of course, the herbs that are grown on the mushrooms. So you can see how the formula, although it addresses more breast health, has a built-in component to address inflammation. That's the beauty of holistic formula. So the answer is yes. That's why the last supplement you take before you go into a biopsy and surgery at high dose, you go up to 20 grams a day the day before, 2 or 3 days before, and for about a week afterwards, until you get your answer, is modified cytospectin. You want to prevent the ongoing inflammation and fibrosis. The second question that we have here is, can you reverse chemoresistance? Let me word it different. Can you prevent chemoresistance? Reverse is very interesting, and the answer is yes, you can reverse chemoresistance. Not easy, but you can. But can you prevent chemoresistance? Yes, you can prevent chemoresistance by making the chemo more targeted, by preventing the survival of the cancer stem cells and the mesenchymal stem cells outside of the cancer that helps the cancer to survive, by reducing the inflammation, and by shutting down the MDR, the multiple drug resistance pumps. So some of the classical compounds that do it, the leading one is quercetin, which was the first one on the breast formula, specifically for this reason. The other one is that we have to shut down galectin-3. Galectin-3 helps cancer stem cells, help mesenchymal stem cells survive. So you use modified cytospectin. A lot of the compounds in the breast formula are compounds that have a similar effect. The other part, something you can do in a more sophisticated way, is you want to remove the growth factors, the inhibitory factors that allow the cancer to hide from the treatment. So you can do it with dietary supplements, you can do it with diet, And we do it, for example, in the clinic with a sophisticated process called therapeutic apheresis, where we filter the blood from the growth factors and the oxidative factors as close to chemo as possible. It's a process similar to hemodialysis. And I've seen multiple times where a patient that doesn't respond to, stop responding to a certain chemotherapy will re-respond to the same drug, sometimes for a short while, sometimes for a long while, but more important, I get a much better, much complete response. A very important natural compound that specifically addresses this issue by its wisdom of being able to differentiate between a cancer cell and a normal cell is called honokiol, which is an active phenol from the magnolia tree. We'll send you some information about it because now that I'm addressing this question, and it was shown to prevent cancer resistance in multiple cancer in multiple animals studies. And the beauty, we understand the mechanism, and interesting enough, we have published a paper showing its synergistic effect with modified cytospectin. So you can use it with the modified cytospectin and with the breast formula. The breast formula is usually not used during chemotherapy. You want to wait 3 half-lives away. The modified cytospectin is used during chemotherapy, and honokiol is essential to use during chemotherapy because of its ability to target specifically the cancer cell and to prevent the resistance to chemotherapy. Okay, wow, only third question, but at least I feel like we're getting a little bit deeper into the answers, so my apologies again if I'm going to get just to a fraction of the question. What's the important question? What can be done to prevent side effects from conventional treatments like chemo and radiation? So we touched on it a little bit. When we want to prevent side effects for chemo and radiation, the first step is preparing the body. We prepare the body by what we mentioned here, by reducing oxidative stress, by enhancing the immune system, by reducing inflammation. So the ability of the body to repair and withstand aggressive therapies is more there. If the tissue, for example, with radiation, is more oxidized, functions more normally, mitochondrial function is better, radiation is more effective, and side effects are reduced. Because there is less acidosis that damages the cells and adds to the burn effect that you get from radiation. And interesting, the very similar thing that will reduce the side effect will enhance the benefits. And so during radiation, we want to make sure that there's a good delivery of oxygen and there's reduction of inflammation. During chemotherapy, we want to pick different compounds that have a synergistic effect and reduce inflammation. So my approach, if you're not sure 100% that this compound is synergistic with chemo, wait 3 half-lifetimes. Wait for the first few days after chemo until there's literally no drug in the body, and then add the compound. But certain drugs are very safe with chemo and enhances. Quercetin being an example, honokiol being an example, modified cytospectin being an example, Scutellaria barbata being an example, medicinal mushrooms being an example, etc. Have you had any success with triple-negative breast cancer? Absolutely. Absolutely. And the success comes when you integrate the different methods that we have discussed with the classical therapies. I've had some dramatic successes with triple negative, some miraculous successes. I've had a number of remarkable successes with a specific breast formula that I've mentioned here. I've had successes when I integrate in the clinic the therapeutic apheresis, and I've had success when the modified cytospectin, the breast formula are used, but always in conjunction with a plan. Nothing here is a miracle bullet point. Treating cancer is not a miracle bullet point. It's a strategy, it's a plan. The other part that helps also to prevent side effects and helps to get better responses from chemotherapy is trying to make the cancer cell more amenable to taking in to taking in the conventional treatment. And I want to emphasize what I'm giving here is general guidelines. You really need to work with the health provider to get specific plans. Although things like modified citrospectin are very safe, it can be taken as a generalized, unique dietary supplement fiber. So one thing that I use often during chemotherapy and during radiation is I will use a calorie restriction ketogenic diet, but specifically during the treatments. I do not use it on a very long-term basis. And the reason, just like somebody can develop chemo resistance, tumor can develop ketogenic diet resistance. It's a common mistake that we have in oncology and also in integrative care. When something great is found, to use it all the time. You want to use it in a dynamic way in the right timing and not allow the cancer to figure out what is going on. That's a dynamic approach that comes from Chinese medicine. How can you prevent? So just to summarize on triple negative, there are good strategies for triple negative, and what's fascinating for me was to find that this specific breast formula was really, in animal studies and clinically I'm seeing, was really as effective in triple negative as it is in estrogen positive. We are now doing the third round of testing with one of the country's leading oncological centers and academic centers on an animal model with spontaneous occurrence of triple negative, that the mice at a certain age, all of them show up with triple negative breast cancer. And we are seeing a significant to dramatic delay and prevention of this triple negative with this breast formula. Very exciting. And hopefully it's now going to lead into clinical trials to prevent recurrence. And that's the next question. How can you prevent breast cancer recurrence? So it is substantially different if you have an estrogen positive tumor or HER2 positive, and if you have a triple negative. When you have a hormonally driven breast cancer, you have to address the hormonal aspects, and in this case, conventional medications are very important. Aromatase inhibitors, tamoxifen, but you want to enhance them and you want to prevent the resistance. And this requires of understanding of risk factors that can drive the recurrence. Inflammation, chronic infections, heavy metals, emotional toxicity and stress, support, all of these energetic issues, scars in the bodies, traumas, all of these come into play in order to address the patient and prevent the recurrence. And it's always easier to prevent. But even if you have a recurrence, it's not that every person who has a recurrence can be cured. Often people ask me, either can you share with us some of your miracle cases? And I have them, I see them every day. We saw some of them yesterday in the clinic. Quite amazing, actually. We had one case, it was really remarkable. But it's important, but it's more important for me to really look at how is everybody doing compared to what is expected. And you see that integrative approaches in general have a benefit on literally all the patients. And at the same time, one of my favorite saying is, every person can be a miracle. Not every person will be a miracle, but each of us, each of you has the potential to be a miracle. And you have to keep it in mind with an open heart, knowing where you are, but keeping the heart and the mind open to the possibility and understanding that because everything changes all the time, that's the reality we live in, nothing stays the same, your disease can also change. It's important to keep this big space. It's an hour, the seminar, I can go, okay, I'll continue a few more questions. What is the link between insulin and breast cancer? So the link between insulin and breast cancer is that insulin degrades the immune system. And actually the insulin effects is related actually to galectin-3 as well, quite amazing. Galectin-3 stimulates insulin resistance, stimulates insulin receptors, that go into the cell and creates an abnormal cell. It blocks, it reduces p53, which is a gene that prevents cancer. It increases something called PTEN and AKT. It blocks AMP, adenosine monophosphate, AMPK kinase, which allows the mitochondria to work normally. And I don't have a diagram here, but for the ones who know, and it stimulates something called mTOR1. All of this, what it does, it shuts down the mitochondria and it makes the cell move into a cancer metabolism, what we call aerobic glycolysis. So all of this starts with insulin resistance, and that's why the weight loss, which reduces insulin receptors and reduces the levels of insulin, had such a dramatic effect, specifically in breast cancer. Maybe last question. Maybe two more questions. Is there a specific protocol? There are a few more. Let me take a look at them. Okay, I'll answer. There are a few really important questions that were picked that I want to answer. So I'll go a little bit quicker now. There's a specific protocol to break cancer biofilm and then cause apoptosis. So the leading thing to use is modified cytospectrin, because the biofilm, the structure of the biofilm is galectin-3. Galectin-3 has something like this. It catches the carbohydrate in a straight arm, and it comes in a pentamer, 5 of them, and it creates, one covers the other. So imagine you get a whole film that covers the immune cells and stops the excretion of cytokine that attacks the cancer, and covers the cancer and make it hide and nourish itself with bad stuff. So galectin, modified cytospectrin breaks it down, and you can add proteolytic enzymes, you can add anti-inflammatory like quercetin and curcumin, and you create a whole mixture, but the central piece is modified cytospectin. And so I think there was a question beyond diet, exercise, sun exposure, and supplement, what's most helpful for breast cancer prevention and treatment. So a lot is included in diet, exercise, sun exposure, and supplements. I think that meditation is very important. Understanding the infinite healing power of love and compassion and an open heart. That open heart can burn anything that we experience. No matter how negative is the emotion, it's like wood that burns. But love and compassion melts ice into water. It allows everything to flow better, and as a result, it's really a powerful healing tool. And I'll just touch two more. This actually should have been my last answer, but to imagine it was the last answer, and I'm going to go to two more questions. Do we take the synergistic breast formula indefinitely with no interruption? And is it possible to keep the receptor sensitive or not? That's a very smart question. So in general, it's always good, like, to take, like, not during the intense treatment, but let's say you finished your treatment and you have an active disease, just you are in a state where there is no disease, there's a potential for cure, you finished your treatment a few months before, and now you're taking your supplement program. It's good to take a break, even a week and a month. And it's especially good to take it if you still have your menses just as you're about to start your menses. So it's a new process. Or if you're postmenopausal or there are no menses, just before the new moon. So you let go before the new moon, and as the new moon rises, starts building up, you start taking more supplements. And this all actually relating to this hormonal balance and metabolism. I was planning to talk about it, and obviously I didn't get to it, to really show you the concept of hormonal balance. It relates to hormones, to metabolism, to toxins, to heavy metals, to stress, to time. So I'm touching the concept of time a little bit here. And the pectosols, the modified cytospectin, you take all the time, because galectin-3 is there all the time, and you want to block the excessive galectin-3 in the circulation all the time. So it becomes this very sophisticated fiber that is taken without a break. And the breast formula, once you move away, and you're a few years away from the disease and the risk of recurrence is much lower, then you move only to 2 twice a day. And for prevention, for people who are healthy, only 1 twice a day. It's a powerful formula. And what is the optimal level of galectin-3 during traditional treatment? It's a good question. You don't rely on galectin-3 levels to decide if you take modified cytospectin or not in cancer. Certain people, and I don't have time to explain it, don't have high levels in the blood, yet they have an aggressive disease, and modified cytospectin will help them. We see it in clinical trials. We are doing a big study on prostate cancer, where it's easier after you remove the prostate to watch the recurrence with PSA. And we see this. So I don't want to get to the reason why. But you want to measure your galectin-3 level, because if they are high in relationship to how much cancer you have, then galectin-3 becomes a very important prognostic marker. And if it's, let's say, if you have cancer and it's over 18 or over 20, you want to consider taking up to 20 grams a day. The reason is you have more galectin-3 that you need to block in the circulation that will help prevent the negative effects of galectin-3, and also you want to have enough modified cytospectin left to get to the tissue level. So I want to thank everybody for taking your time to be with me today. I hope it was useful, and I think we covered quite a lot of questions, and hopefully it was useful. Please email us if you need any more information. You can also visit my clinic website, amitabaclinic.com, and we are here to help with whatever we can. That's our goal in Better Health Publishing. So thank you very much.